Okay. Well, thank you so much, Dr. Primal, for joining us on the podcast.
Yeah, no problem. Thanks for having me.
Absolutely. So, do you mind telling us a little bit about the work you do and how long you've been doing it?
Yeah, so I'm a urologist. So what a urologist is a specialist of the reproductive system. So that includes the kidneys, the bladder, um, the prostate, as well as all the external male genitalia from the testicles to the penis and so forth. So I did my undergrad in Ottawa. I finished that in 2010, and then medical school out in Calgary. And then I did a 5-year surgical residency in urology until 2018. And then I went down to Miami to do my fellowship in male infertility and sexual medicine. And so since July of 2019, I've been in Manitoba here at the University of Manitoba, as well as the men's health clinic that we opened up.
Oh, wow. It sounds like that's a lot of time at school to
Yeah.
finally get to the finish line and then actually start doing the practice. So, where did the idea of the men's health clinic come from? Because I really, really was drawn by the idea that there is actually a men's health clinic as a concept.
No, appreciate it. No, thank you. Yeah, I think it kind of came to us, myself and my partner, Dr. Nyack, probably when we were training. There's always been this, to centralize things has always been sort of a movement in healthcare and trying to centralize things, especially when instead of being something like erectile dysfunction and so forth, it really makes sure that you can provide better care, that you're able to be very comprehensive. And this became even more um, obvious during COVID when there was such huge backlogs. It took months for patients to be seen. And a lot of these men's health conditions, like testicular pain or erection issues and these sort of things, because it's not urgent like cancer, they tend to have to wait. And the one large problem with men is that men are also not very good at seeking healthcare. And so when the waits are very long, they may not want to go seek healthcare. And so it further propagates and leads to worse health care outcomes for a lot of men. And the one thing that we're seeing is that now that we have the men's health clinic, we're seeing a large volume of patients saying, "Oh, I've had this issue for so long. I just never really wanted to address it. But now that there's a comfortable place I can go to." So that's sort of where the ideas came from.
Oh, that's good. And I, honestly, when I saw it initially, I liked the idea that it was one, clinic that was, available for a number of services that men, would be seeking for. And as you mentioned, men don't seek a lot of health,
Mhm.
help, especially regarding healthcare. But I'm curious to know from the work that you've done, what have been some of the common things that clients come to you for? Because I think I remember looking and I could find you in Manitoba, and I'm like, for any male within the eastern region of Canada, like, what are the chances? Would they have to go to your location to access the services?
Yeah, so I think some of the things that probably are very common that we see is issues with erections or penile curvatures. So erectile dysfunction or Peyronie's disease. Peyronie's disease is a penile curvature, and it can cause you to have a curvature of the penis where it can be very challenging to have intercourse. I think the one thing that men often comment about when they come to see us is, number one, they're very happy that they're finally a place that they can kind of speak freely and really speak to experts in the field, but then they don't realize, or they're shocked by how common a lot of these conditions are. They're like, "Oh, I thought I was alone." But realistically, erectile dysfunction is very common. Peyronie's disease is very common, and then even male infertility. So in most situations, we often think fertility is more related to the female partner, but realistically, up to 50% could be a male factor. And so that's another area that people don't even know. And if you look here in Manitoba specifically, I am the only male infertility specialist, but I believe there's 4 or 5 female fertility specialists. So when you have a condition that could be either a male factor or female factor, it's like a 1 to 5 ratio.
Oh,
So a lot of these conditions are very common. So I think that's one of the biggest things. In terms of the geographic region, I would say 99% of men are from Manitoba. We do see some patients out of province, but for the most part, it's localized here in Manitoba.
oh, that's good. And for me, I think the fact that, there was one in Manitoba, I think in my mind, I was like, if ever I'm having any conditions that require me seeking that level of care, that I'm actually closer because it would make things so much easier. But I'm curious to know from the work that you've done, has it made it easier for men to especially seek care, knowing that they're coming to actually someone who also has not only the professional expertise, but also understands the realities of these healthcare needs? Compared to, because I can't imagine myself going to, a practitioner that I don't know if at all they will be able to understand the level of complexity or anxiety around my healthcare condition. So do you think it's made it easier in any way for men to engage with your clinic, knowing that it's actually a resource that is set up for them?
Yeah, that's a fantastic question, and that's something that we're trying to do on a continual basis. Because realistically, and this is a problem that's being faced all across Canada, is that there's such a shortage of specialists, and patients are waiting. If it's for non-urgent conditions, they have to wait several months just to be seen. But could that be dealt with by even a general practitioner? And so we foster a lot of that in our clinic, where we actually have three general practitioners who are just specialized in men's health. And so they actually help us substantially. So if a patient comes in with erection issues, do they really need to see a urologist? Like, do they need to wait 6 to 9 months to see me when I may just be doing non-surgical things on them, right? So, and that's where our general practitioners come from. That we treat every patient with certain algorithms. We provide patients with really structured reading material, so they're like, okay, I understand my condition. I know what the treatment options are, so that when they do see us, they're like, hey, I know what my options are. I really like this idea. And then our GPs are able to manage a lot of these conditions, so that when it comes to see me, it tends to be something more surgical, right?
Okay.
So it's a better use of my resources and seeing a urologist. So it's still a work in progress, but I think that's one of the biggest things that we're doing to, number one, improve access and also reduce wait times. The other thing that's also really beneficial is that because there's only a few urology is not a big specialty across Canada, so a lot of us know each other quite well. So when patients reach out to me from all over Canada, we may tell them, listen, we know someone locally that we can recommend. So I think that's also been beneficial because we have a pretty big social media footprint that we're able to, even if we're not able to provide care here in Manitoba, we do try to provide patients with resources that they can get the care they need locally.
Oh, that's good. And I find that really helps, especially considering Canada is such a big country that
Hmm.
if you're seeking care and having to move quite frequently seeking it, it could take a long time.
Hmm.
But I'm curious to know in form of some of the sexual dysfunctions that come to from your clients that come to you, like which ones have you found have been the most prevalent that a lot of men should perhaps look out for, in their own day-to-day health if they have not had, those sorts of incidences come up so far?
Yeah. So again, fantastic question. I think erectile dysfunction is a big one. And
Okay.
and there's a few reasons why. Is that number one, it is very common, so you don't need to feel alone. Number two, there are very highly effective treatment options for it. But then number three, it actually is an early warning marker for your heart health. Okay. So when men start having issues with erections, and I'm not talking about a 20, 30-year-old male, I'm thinking 40, 50, 60-year-old male that's slowly starting to have issues with erections, you really got to have to start thinking about your heart health, because the blood that supplies the penis is the same blood that supplies the heart, except the vessels are smaller. So if you're starting having issues with erections, it needs to start cluing in that fact. You know what? Maybe this is a blood flow issue. I have
Yeah.
to start thinking about my heart health. And it's not, you're going to have a heart attack in the next year. I'm talking 5, 10, 15 years down the road. But
Yeah.
there's significant lifestyle factors that if you take those into considerations and improve them on, you can not only improve your erections, but you can actually improve your overall heart health and your cardiovascular health. So I would say if there's one key advice from sexual function and preventative medicine, is that piece.
Oh, that's good. And one of the things that I like about what you've shared and is that it's something to do with day-to-day health that people can
Mhm.
go back to and be able to find solutions to it. The one thing that I've heard from many men, especially my friends, has been this panic around, the size of the penis. And
Mhm.
that's something that it's like, I don't know whether it's something that you get a lot of clients coming to you and saying, you know what, Primal, I think I need a hand, on this, because there's a lot of anxiety for men, especially based on pornographic imagery on what, the penises should look like. So is that something that you get the same anxiety from your clients when they're looking to perhaps, explore processes to make sure that they can have, whether a bit more confidence with their body organs?
Yeah, I think 99% of men who look at porn are going to feel inadequate. I think at the end of the day, it's always like that. And when it comes to penis size, again, something like erections and these sort of things, is that no one's going to talk about it, right? So, no
Yes.
one's going to talk about it. So the vast majority of men are well within the normal range, but we have such a societal concept of larger penis is associated with, masculinity, attractiveness, and all these sort of concepts, that we're sort of in this mindset that, I need to be bigger, longer, those so forth. So, I see a lot of men with who have concerns with penis size and length, and my goal as a urologist is, number one, to kind of dispel any myths. I tell patients the facts. I'm like, you're well within the normal range, which most men are. You certainly don't need any more length or girth and these sort of things, but certainly there are options for men once they truly understand, and making sure that they really understand the reality of the situation. And
Yeah.
and sometimes that some people may have unrealistic expectations. And so, once you've sort of cleared that out, then there are options for girth and length enhancement. But really discussing what are the pros and cons, what is reality, and what can you truly offer, and do these things sort of matter. And I think this concept of male cosmetic urology, it's sort of a newer sort of thing. But when we think about our the female counterparts, cosmetics and for women have been it's been forever, and
Yeah.
that's sort of been ingrained in culture, that that's commonly performed. But the male side of things, it's something that's sort of kind of a newer sort of thing that's starting to come out.
Yeah. And it's interesting you mentioned that, because one of the things that I've had on the flip side of men anxious about the penis sizes has been those that have what some people call a micropenis. And
Mm.
that sometimes becomes really the one sort of alarming example that men often refer to as something they want to run away from. That if you pointed that there is someone with, you know, a smaller penis on one end, most of the men will be queuing on the other end to see, whether it's for size. And is this something that that is a common reality, or is there just a general exaggeration of that within the male population in general? Because I sense that there might be an of exaggerated reality to sort of say, oh, like maybe I should be anxious about my penis size because someone is feeling like it's not something as close to what they would expect it, for the normal adult.
Yeah, yeah. Like, the micro penis is extremely rare. You know, I
Okay.
can, I can count, very seldomly have I ever truly seen that condition.
Okay.
But I think, but on the flip side, how many times have I seen men who had concerns of my micro penis?
Yeah.
Quite a bit, right? So a lot of men come in concerned about their penile length, um, and it's not really based in reality, but it's a legitimate concern, right? They
Yeah.
they see everything out there, they're reading all this information out there, what they should be, or how their penis should look. And I feel for a lot of these patients that they kind of get sucked into this, and start feeling inadequate. And so it's sort of my role to make sure that I counsel patients what is realistic, what is normal penis length, and so forth. And then we kind of go from there.
Yeah. No, but I like the fact that you really use education to, inform, patients in terms of what is actually healthy and completely fine. Because I feel like sometimes that's an area that, men could use a lot of, resources to really get that clarity. The thing that I'm curious to know for you has been also the element of age and aging in, especially in male health, but also male reproductive health
Mhm.
specifically. Do you find, from some of your clients that there is an openness to seeking care, as they age? Because I think the reality is that a lot of men, after 50, there is realities about the functionalities of our bodies that are going to change, that will require us to have a level of, continuous engagement with, with seeking healthcare. And is this something that you see that is a reality in terms of generally encouraging men to seek, like reproductive health care, especially since the topics are generally very difficult to talk about?
Yeah, I think it's 100% important. I think the trouble right now is the access, right? There's, nationwide shortages of primary care physicians. Patients are having trouble getting in. And so we're really only treating problems when they become a problem. But this whole concept of preventative medicine is something that we really need to have a greater emphasis on, right? Even if you have no issues, get a checkup, check your blood work. Is there something that I can work on now that may provide or prolong my health in 5 to 10 years down the road? And I think it's really important that we start, hopefully at some point, once we can sort of get control of healthcare, is really focus on preventative healthcare and preventative medicine, because we really should be looking at 20, 30 years down the road. What physical level activity do I want to be when I'm 60 and 70? what do I need to now to achieve those goals? I think the trouble is right now is that we're sort of we're putting out fires. We're treating conditions when they become a problem. We're only dealing with stuff when someone brings up an issue. But I think for the most part, I mean, if you speak to anyone, they all want the same thing, right? They want to they want to retire at a reasonable age. They want to be healthy at that age. They want to be able to do the activities they love. So how do we accomplish that? And I think we need to start thinking that a lot sooner than what we've currently been doing. But to answer your question, I think, and it all kind of comes together as well. I think for the vast majority of conditions that I treat, um, obviously some of them are going to need to be dealt with surgical or medical conditions or medications. But I would say a large proportion of them could really be managed by healthy lifestyle, exercise, diet, proper sleep, nutrition, and so forth. Um, but that takes such a long time to sort out and figure out that sometimes it's not as easy to work on that, if that makes sense.
Oh yeah, it does. It does. And one thing that, for instance, from my own personal family history, has been having family members that either have prostate, and knowing that, I remember one time a family member said that, oh, like, you should be careful and not have sex because otherwise you'll get a prostate. And I remember being so freaked out as a 16-year-old to be like, hang on a moment, is this really the trajectory that will lead me to having a prostate, like down the line? And I remember, you know, having a family member dealing with prostate cancer. I mean, you are not going to get a more alarming message, than that. And yeah, and I thought I would ask and say, what are the correlations, for instance, if you have a family member that has had, testicular cancer or prostate cancer, in terms of, that being a genetic or family thing, especially among males? Because I think there's a lot of scaremongering out there that really sets a lot of alarms that are probably not justified.
Yeah, no, for sure. I mean, when we think about specific cancers to the male organ, so we think about testicular cancer, prostate cancer, penile cancer, which is very rare. But when we think about testicular cancer, it's probably one of the most common cancers among men that are 20s, late 30s, right? So
Oh,
in the grand scheme, it is very common
okay.
in that sense. Like
Okay.
overall, how many patients actually develop testicular cancer? In Manitoba, we have a population about 1.2, 1.3 million, I believe, and we'll often see about 40 to 60 men a year with testicular cancer. So not a huge volume, but in generally speaking, in that age category, that is a high incidence of cancer.
Yeah.
Now, what are risk factors for testicular cancer? Family history is part of it. So if you have someone with a family member who had testicular cancer, if you've had testicular cancer in the other testicle, that's a risk factor. If
Okay.
you have something called undescended testicles, where the testicles have not fully descended, that's a risk factor. How do people pick this up? What's going to happen is they may feel a hard, painless lump on the testicle. It may increase in size, but that's the first sign and symptom of testicular cancer.
Okay.
So at the Men's Health Clinic, we do quite a high volume of removal of testicles for testicular cancer. Fortunately, the outcomes of testicular cancer are very high, whereas survival at 5 years can be over 90%. So if detected early and we remove that testicle, survival is very high. And even in situations where you may need other therapies like chemotherapy or radiation, survival is very good. So again, there are some patients who don't fare as well, but fortunately, if detected early, we're able to help a lot of patients out. And then in terms of long-term outcomes, if you remove your testicle, fertility and sexual function is preserved, so no concerns there. When we think about prostate, a lot of myths, like just as you're saying about the sexual intercourse. I think every male has a prostate. It does grow over time. It naturally grows. The prostate produces a lot of fluid that's responsible for nourishing the sperm. So it does serve a vital reproductive function. In terms of prostate cancer, realistically, we often don't recommend screening till about 45, 50 in men who have a history of or family history of prostate cancer. And general screening is about the age around 50. And that's just with a simple blood test, that PSA test.
Okay.
If people, when we think about what are risk factors of prostate cancer, um, family history is a key one. So if you have a family member who've had prostate cancer, but that tends to be um, patient, the ones that we get a little bit, trying to be on top of is patients who have a family history if they've been younger when they were diagnosed, right? It's a different story if your father was 90 years old when he was diagnosed with prostate cancer, then maybe he had a high grade prostate cancer at 40s or 50s. So that's something that we do get a little bit, okay, well, maybe we have to be a little bit more over screening in this individual. So we do have
Okay.
sort of guidelines and trying to make sure that we screen people appropriately. Like, in terms of just screening everyone at the age of 30, you're going to screen way too many people. You're going to put them through a
Yeah.
lot of blood tests and biopsies that are needless. So we're trying to do this more of a risk-based approach. Um, but in terms of the younger patients, sometimes we'll see patients in their 20s or 30s who are very alarmed about prostate cancer because they may have had a family member. And again, our goal as urologists is really trying to make sure that they understand the data. We know that we really clarify what was the family history and really set a plan so that they understand. Well, when I hit that age, I know what to do at that point. So um, that's sort of how we approach it.
No, that's good. And I like the fact that at least, you've allayed a lot of my fears. And I'm sure many of our listeners also will have such fears because I find that men don't share even much about their own reproductive health to begin with. So it's like
Mhm.
if someone is dealing with a situation, it's going to be such a guarded secret until someone decides to show up at your office, seeking help. The thing that I find that is really interesting about younger men is performance anxiety.
Mhm.
Now, I don't understand where it comes from, and maybe in that age range, many of my friends that I talk to seem to have, like heightened expectations on the sexual performance. And I'm just curious to know from your work or from any research you've had access to, what is a trend or what are the circumstances that are leading to that heightened sense of higher performance for men, and in contrast the difficulties for those that are not feeling like they're being able to perform sexually in that kind of way? And what are some of the truths and half truths and mistruths in that situation that we probably need to allay to remove that kind of misinformation?
Yeah. We see, or I'll see at the men's health clinic a high volume of young patients presenting with sexual concerns, like having issues with whether it's premature ejaculation, erectile dysfunction, or delayed ejaculation. And I think this is a very challenging situation to treat. When we think about erections, like what goes into an erection, there's blood flow, there's nerves, there's hormones, um, and then there's a large psychological component to them as well, right? And that could be the biggest killer of them all. Or you could have an issue with all of them. So when I see patients with erectile dysfunction, we really try to work them up in several factors. So for blood flow, we'll get a past medical history, but there's also a penile Doppler test where you can actually measure the blood flow to the penis. Hormonal, we can measure their testosterone levels. Nerves, there's no real specific test for the nerves, but if they've not had any prior surgeries or they don't have any history of any neurological conditions, it's unlikely to be impacted. But then the psychological aspect, how do you actually test for that, right? There's no test, right? The biggest things that I ask patients, especially young patients, is that are you able to masturbate without any issues? And sometimes patients will say, when I masturbate, it's not a problem at all. But then when I'm with a partner, I'm having issues. So then you're trying to get them to really sense of trying to get them to correlate. There is a correlation, right? And trying to get them to truly understand. I think it's quite tricky because um, sometimes it's very hard for us to truly understand or appreciate that there could be a psychological component there, that we're creating these potential barriers of anxiety. But I think it also stems from these patients who also have having concerns with respect to their length or girth. There's just so much misconceptions out there. What is normal? How long should I be having intercourse for? My erections aren't as hard. So I think it's really trying to break it down. It's very rare to have a truly a organic or a cause for your erectile dysfunction at young
Okay.
ages. In the vast majority of men, over 90% in 20s, 30s, even early 40s, it's mostly psychological.
Okay.
But it's number one, taking patients seriously, making sure that we're ruling everything else out, and then trying to identify if there is a psychological component. And then there are sex therapists that we tend to work with who are specialized in this that can provide guidance in terms of trying to breaking down those barriers.
No, that's good. And one of the things that that I really like about that I'm curious is, so if someone is anxious about these conditions and they're looking for perhaps lifestyle decisions that they could take that actually have a much higher, likelihood of helping them through these conditions rather than raising the anxiety about, and panic around the situations? What would be potentially some of the more lifestyle, choices or hobbies that folks could pursue that actually remove all the performance based or psychological kind of, like anxieties around sexual performance and all of that?
Yeah, I think the one key aspect of all that is making sure that you're exercising routinely. I think it can't be said enough the beneficial impacts of cardiovascular exercise, and it doesn't need to be anything groundbreaking, but just getting out there, exercising, using a combination of resistance training and cardiovascular can really help with the mental aspect. There are some situations where if patients are having issues with erections and intercourse, I'll also kind of gauge how often are they masturbating, or if they masturbate. And if they're masturbating quite frequently, trying to make sure that they limit that, because that could actually make them more responsive during the when their times they are sexually active. And the other area that I commonly see is that patients will have intercourse and they say, "Well, I lose my erection so quickly." And then when I talk to them about masturbation, can you maintain an erection during that time? They're able to. Then a lot of it has to do with the stimulation. Well, it's like you're not stimulating yourself to how you are when you're having intercourse. So trying to get them to work with your partner. If you're with a long-term partner, be open with it. I think the one challenge that a lot of men face is that we just don't talk about these issues, that maybe we don't want our partner to feel that it's their fault. But in most situations, patients are with very supportive partners, and having that conversation could actually push them closer together. So in a lot of times, I do try to get um, the patients to come in with their partner, because I think it's very key to have them both there for the consultation.
Yeah. And I love that. And I think that's something that, especially conversations, with partners is especially important, because I think there's a lot of panic or anxiety or sometimes tension that builds when these things are not discussed,
Mhm.
within a partnership. And then, it's almost like a guarded secret that, you know, really, really impacts other aspects of life. The one thing that I wanted to ask is in relation to pornography, because I think between now and the beginning of the millennium, when the best you could get is perhaps a magazine and all of this,
Here's
and
catalog.
yes, like he has a catalog. And I think looking at how the access to pornography has also proliferated in the last 20 or so years, but also how that could be impacting, like men's productive health in general, but also the expectations of sexual interactions and the panics and anxieties that come from that. So do you see perhaps any way, like the proliferation of pornography has perhaps led to some of these, like male reproductive health issues that are coming up in your line of work?
Yeah, it's a good question. Like certainly, I'm sure that having readily access to all of this is going to lead, especially young patients, when they have really no one to bounce this off of. Right? They're not gonna go to their friends and say, "Oh, wait, wow, that guy lasted a long time." They're gonna,
Yeah.
and then their friends are gonna be like, "Oh, you don't last that long." So it's one of those situations where they're gonna see it and be like, "Oh, so that's normal size. That's how long it
Yeah.
should take." And
Yeah.
and so that's gonna feed into these potentially harmful and unrealistic expectations that could cause some, depression, anxiety, and potentially even fear of getting into a relationship, because they may feel that they're going to be unable to live up to the expectations that they're seeing. So I think that is one of the larger harms that we see from this. However, at the end of the day, it's not going to change. Pornography is going to be available. It's going to continue to be available. So how do we navigate this, right? And I think that's where opening up these conversations, what you're doing here, and getting the messages out is really important, because um, we do need to state about how this is not reality, right?
Yeah.
And to letting especially the young people know that.
Yeah. I mean, thank you. And and one thing that I love about, your work is also that it's created such an opportunity for folks to be able to access, care, especially, and sometimes whether it's information, and I know your website provides a lot of resources also on that front. The one thing I wanted to ask is that, so if someone is listening to us and saying, where do I start? And they're like, oh, I'm a middle-aged man, perhaps in the 30s, and they're looking to really explore perhaps some of the things they should keep top of mind regarding, like their health going forward, or perhaps things to explore or information to seek, while they're, exploring this journey. What advice would you have for someone that is listening in and perhaps saying, what, how do I begin, or where do I begin from now?
Yeah, I think it's great. I think if anyone was listening, just number one, talk to your GP, right? If you have a GP, if you don't have a GP, find one. In a lot of provinces, they do have physician finders. Like here in Manitoba, I didn't have a general practitioner, so I went on the website and then I was connected with one really readily. So I think there are certainly resources that all our provincial governments are doing to, connect patients with a point of contact. So I think number one, getting a GP, speaking, even if you're young and it's maybe just a check-in, but having somebody there that you can go to if you have a medical problem. And then number two, check out our website. Go to the mhclinic.ca. We have a lot of information on there. We have a lot of patient brochures, information. So we're starting to create a YouTube channel just to go kind of further deep dive into a lot of these medical conditions. Um, so I think the one biggest thing is going to the local GP, checking out professional online material that is going to be proper, like the Mayo Clinic and that, where you can actually get credible information. But I think that's the first way to start.
Absolutely. Well, thank you for that. And
Well, thank you so much.
thank you too. Thank you so much for this conversation.
Okay, take care.
You too.